And I think we are streaming live, so I will take it. Okay, I think we're ready. Dr. White, are you ready?
Yes, I'm ready.
Okay, perfect. Okay. Good evening, TCM Gynecology and the greater Chinese medicine world. This is Michael Peluso with TCM Gynecology. Tonight we have Dr. Laurena White returning again. Dr. White, nice to see you.
Hello,
She's
how
going
are
to
you?
be she's going to be discussing red flags in gynecology, really important things for you to know to look out for in your practice that could potentially save lives. So, Dr. White, I don't think you need any further introduction. I think we'll let you take over, do your thing. Let us know if you need anything. Otherwise, I'm going to turn it over to you.
Okay, well, there was their slideshow, and you'll get the slides later. But the main slide is red flags of gynecology. And I want all of you to focus on the 3 R's: recognize, refer, and reevaluate. So when you first get into a situation and you're not quite sure, let's just think about what are red flag symptoms and what does that mean? So red flag symptoms are clinical indicators of a possible serious underlying condition. And we'll get further into this when we talk about differential diagnosis of a symptom and what all of the possible conditions it could be. But just because someone has a symptom does not necessarily mean that they necessarily have it's a red flag symptom doesn't mean they have an urgent and important, critical, dire condition. That's when differential diagnosis will come into play. And when we recognize these red flag symptoms, these are mainly dependent on a history and physical exam. So a lot of times, unlike physicians, unlike those who are working in hospitals, those who are working in clinics of a Western medicine sort, we don't have a lot of diagnostic or other investigative tools and resources at the ready. So we're really going to have to work with history and physical exam to make sure we are diagnosing and recognizing these red flag symptoms appropriately. So red flags can be broken into general or specific. So when you think of a general red flag, weight loss and loss of appetite could be due to so many pathologies. And I'm sure all of you can think of several right away when you think of someone's losing weight, someone has a loss of appetite, all of the many things it could be, everything from influenza or the flu or even the flu vaccine at this point in time. But then when you add loss of weight, we're thinking potential cancer, we're thinking diabetes. It could be a large group of conditions. And then we think of hematemesis and melena. So that is more specific red flag symptoms, and that is leading us to look toward a GI bleed or gastrointestinal bleed. So there you see the difference between a general and specific, and we need to take that into consideration when we're talking about red flag symptoms. And so, like we talked about before, red flag symptoms are specifically designed to warn us of the possibility of a life-threatening disorder or condition. And regardless of what the acupuncturist, the physician, the herbalist determines, that identification of a red flag symptom is always going to warrant further investigation and possibly a referral, depending on the evolution and all the other symptoms that go along with it. However, this is an integral part of integrative medicine because sometimes our patients do not have a primary physician. Sometimes they have not been to their primary care physician in years, and they're looking at us as their primary care physician. And it's very important that we take this into consideration, our roles in making these diagnoses. So when we're looking at gynecological red flags, there's symptoms and then what the possible conditions and the differential diagnosis could be. So I'm going to name 1, 2, 3, 4, 5, 6, 7, about 8 different symptoms. And I'm going to give you just silently some time to think about, and just a couple minutes, not a minute, a couple pauses to think about what comes to mind if I say the symptom. So let's say a patient comes in and they have bumps and or masses in their genital region. Think about some of the things that might come to mind right offhand. And I'm using these terms because these are the terms that your patients are going to use. before you do a evaluation and do an examination. So think bumps and or masses. They could say bumps and they could say mass, and they could say bumps meaning a mass, and they could say mass meaning a bump. And that's why it's important to do an evaluation and talk about the evolution of the bump and or mass. So these are the things that possibly could be associated with bumps and or masses: uterine fibroids, hernias, cysts, sexually transmitted infections, folliculitis, which is associated with razor burn, varicosities, sebaceous gland inflammation, ingrown hair, skin tags, lichen sclerosis, which we'll talk about later, and cancer. So many of you probably came up with some of the first three, but they could be a bunch of different things. Obviously, cancer is on the more serious end of the spectrum, and STIs, of course, and something like an ingrown hair or razor burn, also not really a cause for an immediate arrival to the emergency room or to an urgent care facility. The next symptom is burning urination. Give you about 5 seconds to think about what comes to mind when you hear burning urination, or it hurts when I urinate. So 3 things that immediately come to mind are skin irritation, urinary tract infections, and yeast infections. So skin irritation could be, again, from shaving or just some type of local inflammation, a urinary tract infection, and a yeast infection. Of course, a urinary tract infection is going to require medical attention, and so is a yeast infection. This one is also, the next one is important. You'll see it when you on the slides, it's bolded. Bleeding after sex. Take a couple seconds and think about what bleeding after sex could be. So if a patient says, well, it's been a while, that could be a possible reading from bleeding, because it could be vaginal dryness. Lack of lubrication. They could be on their period, either just beginning their period, just ending their period. A cervical polyp could be involved, cervicitis, genital sores, vaginal atrophy, uterine prolapse, or any type of pelvic floor organ prolapse, and again, cancer. Again, cancer is on the high end of the spectrum in terms of urgency and importance, and lack of lubrication can be easily remedied with no pharmaceutical intervention or no surgical intervention at all. The next symptom is weird looking and or foul smelling discharge. Discharge of any kind it requires the immediate need for some type of intervention. And it could be anywhere between bacterial vaginosis, a yeast infection, chlamydia, gonorrhea, trichomoniasis. And also it depends on when that discharge is coming during the cycle, whether it's coming during ovulation time, if it's all throughout the cycle, or after, and the color. Bacterial vaginosis and yeast infections always have their a specific type of odor, and they have a distinct look. So those are things that you need to be aware of. I'm not going to go through each one of those because that could take a long time. But those are things to look out for when you're examining a discharge and asking the patient about them: color, consistency, and when it occurs during the cycle. A swollen vagina, meaning the labia majora, also not something that happens often, but it is a symptom that happens frequent enough that it may cause some concern for the patient. And that could be an inflamed or swollen Bartholin gland cyst. Some women, mostly young women, get postcoital, a feeling of swelling or swollenness. And also at a first period, an adolescent might have a symptom of having a swollen labia majora. The next symptom is uncontrollable itchiness. And uncontrollable itchiness is something that definitely, again, kind of goes into hand in hand with discharge. But it could be contact dermatitis from the soap, perfume, dyes and panties or sheets or clothing, and fabrics that are just irritating to the skin. It could be desquamative inflammatory vaginitis. It could be a yeast infection, or it could be lichen sclerosis. And we've talked about this twice now. We'll talk about it with more detail later on, but it's something that happens with our menopausal patients. So you'll need to, like, again, take that into consideration, the patient's age, when considering what symptom is a red flag and distinguishing it from other symptoms in terms of importance and urgency. Menstrual bleeding we're all familiar with. And again, we've talked about what menstrual bleeding could be from a lot of different perspectives. But as we consider that, it could be a sexually transmitted infection, irregular ovulation, fibroids, polyps, adenomyosis, medications can cause menstrual bleeding, cancer, endometriosis, could be a miscarriage, or a pelvic inflammatory disease. And the last one is the something's falling out sensation. And when a patient complains that something feels like it might be falling out, a lot of people automatically jump to pelvic organ prolapse, but it can also be a foreign object extrusion like an intrauterine device. And that's very important to determine which it is, and to finding out if they actually have an IUD placed, because that could definitely clear up a lot of different possibilities in terms of that sensation of feeling that something's falling out of their body. All right, so we're going to talk about the first red flag in terms of order, not so much in order of importance, but the ones that I feel are the most common. So the postcoital bleeding. So we're going to go back to the first three things we talk about in terms of recognize, refer, and reevaluate. So in terms of recognize, so first things that you need to think about for postcoital bleeding, is there any vomiting? Is there any fever? And what kind of bleeding are we talking about? Is there pad meaning feminine hygiene products, pad saturation in less than an hour? What kind of bleeding are we talking? Is it profuse? Is it spotting? And if those things are associated with postcoital bleeding, we're definitely talking about something more serious, and you need to make a referral immediately. And referral doesn't mean necessarily calling a doctor. It could be referring them to an urgent care or the emergency room. Sometimes there is the timing, or when you're contacted, there may not be a doctor's office open. They may not be able to get into an appointment immediately. So that will require getting them to the doctor at an emergency department or at an urgent care facility right away. And then the reevaluation point. I think a lot of times when physicians, and not so much physicians, but I think acupuncturists make a referral, we forget to follow up with the patient in terms of how they're doing, not to find out when they're coming back to get treatment, but following up to find out, okay, what actually was going on in terms of your differential diagnosis. Was it something that you planned on, something that you thought about, something that made sense for you? Or was it something that completely was out of the blue for both you and the patient? So following up to update your status of the patient, following what kind of workup did they receive, what was the diagnosis they received, so then you can better determine how your course of action as their acupuncturist and their herbalist. The next red flag is discharge. So we talked about earlier about 3 different types of all the different things that discharge could mean. We talked about bacterial vaginosis, we talked about trichomoniasis, we talked about gonorrhea, we talked about chlamydia, we talked about yeast infections. So it's important at this stage to know what each infection looks like, or what discharge looks like. So when we're talking about bacterial vaginosis, we are thinking thin, whitish gray, and there's a distinct fishy smell. On the slide, you will see like a lot of different fish on the screen. So think about, are they talking to you about a smell that's pretty repugnant, pretty uncomfortable? And usually, unfortunately, also talk about using feminine deodorant sprays or something of that nature to mask or hide the smell, which is also a bad thing because it's further irritating and will propagate more of the discharge. A yeast infection differs in that, yes, it's thin and white, but the consistency is completely different, and it's also associated with itching and burning. So that's something to take into consideration. an STI, whether it be chlamydia or gonorrhea, will have a distinct color. Sometimes it'll be green, sometimes it'll be yellow. And you also have to ask about other symptoms such as pelvic pain, bleeding, itching, and urinary discomfort. All those things will definitely play a part in determining exactly what we're working with. So it's important that you can recognize these symptoms. And when to make a referral depends solely on the duration of the symptoms and what symptoms that you're recognizing. A yeast infection or bacterial vaginosis, if they've been going on for a long period of time, the patient may have gotten used to it, and they might not, unfortunately, they may not even mention it as a symptom. If it's new or if it's an STI, it may come up, but if there's burning and itching, they might tell you that they've had repeat recurrence of yeast infections, or they may tell you that they always have a recurrence and they're always taking an antibiotic. Those are also things that you want to keep in mind, because there's also some type of hormonal imbalance that needs to be addressed. If there's any type of bleeding, any type of urinary discomfort or pelvic pain, that might be something that, depending on the evolution, the duration, and the intensity, it might be something that needs immediate care. And regardless, for reevaluation, you want to follow up within 1 week. One, to find out if they were able to get an appointment, were they able to get an antibiotic? Was it something else? Was it something more? Sometimes we'll get to a point that they have discharged and they'll have a completely another set of diagnoses that are correlating or non-related that you need to take in consideration. But within a week, you want to make sure, one, that they've gotten a diagnosis, they've gotten it treated, started on an antibiotic, and then you can chart your course from there. The next red flag is itching. So you want to, how do you recognize it? And when you ask your intake questions, are they sexually active? Are they menopausal? And could this possibly be contact dermatitis? And how do you ask about contact dermatitis? Have you changed detergents? Have you gotten new panties? Are you wearing any panties? Have you used any dyes, any changes in soap, any type of different bath gel, body sprays, anything that could possibly come into with the vaginal tissue that could be irritating. And fortunately and unfortunately, some women will have used a product for 10 years with no problem, and then out of the blue, sometimes companies change 1 or 2 components in the product, and it will again cause itching and or irritation. And sometimes it's just a matter of that body chemistry changes as we get older, and that the body chemistry will no longer agree with the product, or the product will no longer agree with the body chemistry. So it will cause some itching there. Again, in terms of making a referral, ask about the duration, ask about sexual activity, and ask about age, and then you'll be able to rule out some of the possibilities and determine the urgency and the importance. Again, in terms of reevaluation, you want to determine how you're going to manage the symptoms and potentially some lifestyle changes that may help lead to the avoidance of the symptoms in the first place. The next red flag is menstrual bleeding. How do you recognize it? Of course, we know by asking the important questions. Are they bleeding longer than 7 days during their menstrual period? Are they saturating a pad within 1 hour? Are they having clots that are the size of a quarter or larger? And are they losing more than 30 to 80 milliliters during menses? 30 to 80 milliliters during the whole menstrual cycle is acceptable. When we start moving to like 100 milliliters, that's more than comfortable. Anything more than 100, 110 is definitely something that is worrisome, because they'll start affecting the other factors that we look at when we're looking at anemia and things of that nature. Hemoglobin levels and things that are Western medicine oriented. However, those are the things that are going to be looked at when we have in terms of blood transfusions. And if it drops, those factors drop below a certain level, one can affect the other. And in terms of referrals, depending on how intense and how long these symptoms have been going on, you might want to ask about fatigue. You might want to see the color of lips and the sclera of the eye, the conjunctiva of the eyes. If this has been going on for months, weeks to months, and potentially even years, there might be necessary for an immediate referral. And it could be, within the month or so, depending on the duration and the severity. What's important is for reevaluation. What were they diagnosed with? How were they diagnosed? And what was the subsequent treatment, so that you can adjust fire and diagnose accordingly. And I think one of the things that come to mind is giving blood invigorating herbs when someone's losing blood every month. Even if they potentially have a fibroid or adenomyosis, something that we think of as associated with blood stasis. But if they're losing blood every month, the order in which we use those blood invigorating herbs can be potentially detrimental to the patient if not prescribed in a way that's not going to cause additional bleeding. The last red flag that we're going to talk about is pelvic organ prolapse. So the organs that are associated with pelvic organ prolapse is obviously the uterus. It could be the bowel, and any of these things could potentially, and the bladder could potentially cause symptoms. So the first R in terms of recognize is, are they complaining of pelvic area pressure or fullness? And not many of you can or will, but sometimes you can ask them, are you able to see the extrusion of the organ? And extrusion means the organ has crested the vaginal opening, and they're able to either feel it when wiping, or it's tender, but they know it's now almost coming out of the vaginal opening. That's not something that is in the scope of practice for an acupuncturist, but if it has happened to the patient, they will definitely tell you that they can feel something when they're wiping, or they'll be able to say that they've seen it with a mirror when they've, done a personal exam. Painful intercourse is always going to be a potential part of the equation. They may actually say the word something is falling out. Urinary incontinence, spotting, and bleeding will be also part of the picture. So make sure you add those questions. If their organ is actually cresting the vaginal opening, that is an immediate referral with no questions asked. They need to go to get immediate help, because that is an urgent matter. And there are different stages. Again, I won't go through the different stages of pelvic organ prolapse, but spotting, bleeding, urinary continence, the mere complaint that something is falling out will could potentially require an additional level of follow-up. And when to make that referral. And this is something that a lot of people do not take into consideration. Refer to a pelvic floor physical therapist, not necessarily a gynecologist. If time is of the essence, you want to make sure that you get them to someone who can make a diagnosis based on the status of all the pelvic floor muscles. And sometimes gynecologists are limited in that scope. They can recognize it, but in terms of actually what they can do, sometimes surgery is necessary depending on the degree and the stage, but a pelvic floor physical therapist can also work with them so it can be healed without the need of surgery or a surgical procedure. Again, the urgency depends on duration, evolution, the stage, the age of the woman, and the organs in question. Whether we're talking about bowel, uterus, or bladder, again, we have to take all those things into consideration and the associated signs and symptoms. Regardless, you want to follow up and reevaluate within 1 week to determine if they made the appointment, and again, if they did, what was the diagnosis and what's the way forward. And that's the last one. Are there any questions?
Let's see if we have any questions. Participants, if you have any questions at all, please put them in the Q&A section. So we will not be answering any questions from Facebook. It's only the participants that are logged into Zoom right now. So those of you who are logged into Zoom, you will see in the lower center portion of your screen as participants a Q&A. So if you have any questions for Dr. White, please enter them there. We'll give you a couple of minutes to do that. In the meantime, Dr. White, thank you so much for taking the time to do this for all of us. It's really, really appreciated and really important. I don't think we get nearly enough of that education in our schooling, so it's really good. And even if we did, it's good to have a backup and a refresher. So that's awesome. Couple of things while we're waiting to see if there's any questions. Dr. White and I are co-teaching the endometriosis webinar coming up on Saturday, October 19th. There are still seats available for that. It is live online. It's a webinar, but if you purchase it, you still will be able to watch it afterwards. But you want to take advantage of it now. There is a sale still going on for, I think, the next couple of days, and you can find that. There's a link below, I think, somewhere, and if not, I'll put it in the post below this in case you want to get that and participate with us. That's going to be good. We're going to be, again, co-teaching, talking about the Western medicine, about the Chinese medicine, case studies. That's going to be a fun one. I'm looking forward to that very much. Dr. White, do you have anything else to add? We don't have any questions yet, so it looks like you did a really great job.
Or it was really confusing. I'm not sure which one. Again, I didn't really go into a lot of the differential diagnosis because I believe that's beyond the scope of what we're working with here. I think the most important thing is to be able to do the first two steps. Actually, all three are important. Like being able to recognize it as a red flag is very important. And knowing how to ask questions that elicit the answers that are going to help us with the identification is critical. I think sometimes, again, when we ask a question about, let's just say, itching, a patient will say, or spotting, or any symptom that could be potentially generic, we don't ask that next question that will elicit the answer that's going to help us make that identification appropriately. So then we potentially don't make the most appropriate referral in a timely fashion, and then the evolution of that symptom gets to a place that it couldn't be. And on the flip side, because our patients sometimes do not have a primary physician or a practitioner, we're the ones who bear that onus of being able to identify, being able to recognize and refer to the medical professional. And I think when patients who don't go to the hospital, don't go to the doctor, when your acupuncturist says, yes, it's time, that is their hand-holding step to say, okay, I trust you. And if you say it's time for me to venture out to see a Western medicine practitioner, you're the trustworthy practitioner that they're looking for to say, okay, if you say it's time, then I believe you, and I'll make that next appointment. But it's also important to follow up. Once you make that handoff, yes, it's important that you've made that first step in making the handoff. But they're out there in the ethos. Did they go to the doctor? Did they go to make that appointment? Did they go to the ER? Did they go to an urgent care? What happened? And sometimes, you make a great handoff, but you don't hear from someone for 2 weeks, 2 days, to 3 months, and now they're just out there. And it's important just for continuity's sake and continuity of care, and so you can build rapport with that the receiving physician or the receiving team about how you're doing your care. They may be the ones who, never seen this patient before, and they need you to help them with, filling in some blanks of some history, what you've been doing, what you've been working on. So I think it's really important to be able to recognize, refer appropriately, and again, follow up for reevaluation so that we have the continuity of care and build the integrative approach to health and wellness.
Okay, Dr. White, thank you very much for everything and always for your time. And I know I speak on behalf of the whole group. We really appreciate you helping us out a lot. It's really great. So everyone, if you have any additional questions, you can post below the video in the group. Dr. White, I'm sure we'll get to it in time and answer any questions. She's generally really, really good about that. So just her schedule depending. And we do have a slideshow that she will send to me, and I'll upload in the files section if you want to have a copy of that as well. Otherwise, I think we're good. Dr. White, have a wonderful evening. Thank you again for your time. Thank you all for spending your time with us this evening. It is valuable, and we'll see you on the group again.
Okay, take care.
Bye-bye.
See you.
Take care.
Bye-bye.
Good night.